Hello, and welcome to part one of Harvester's virtual For Good series. My name is Matt All, and I'm President and CEO of Blue Cross and Blue Shield of Kansas here in Topeka, and I'm proud to serve as the honorary chair for this event. We're coming to you from the Harvester's warehouse in downtown Topeka, where they serve so many families across our region. I'd like to thank our sponsors for their generous support of this event. They do so much good for our community, and we're really grateful to them. So here is our fundraising goal for Good, and we'd like to thank everybody who's contributed so far, and this is how much we've raised so far. We'll give you more information later about how you can support Harvester's efforts to feed hungry families, children, and seniors in our communities. But today we are here to talk about an important issue in our community, hunger and its impact on the health of our community. So when we say somebody is at risk of hunger or food insecure, what does that mean? Well, it means they may have food on the table today, but they don't know if they're going to tomorrow or in the days to come. And hunger has, of course, been an issue for a long time, but in this new world that we're living in with COVID-19, hunger is on the rise and the needs are greater than ever before. Blue Cross and Blue Shield of Kansas has long been committed to combating hunger in our communities, and we do that because we know it's linked to the health of our members and our communities all across the state. So this is an important cause for us. I am really happy that I'm here with two fabulous panelists. We have Dr. Robert St. Peter, I call him Bob. He is the president and CEO of the Kansas Health Institute. And we have Jessica Kejr, the director of programs and client collaborations at Harvesters. Thank you so much for being here.
Glad to be here. Thank you.
So Jessica, let's start with you. If you wouldn't mind, could you share a brief overview of Harvesters, your initiatives, and who and how many people you were serving before the pandemic struck?
Sure, thank you. So Harvesters, we are the food bank for this region. Our mission is that we feed hungry people today and we work to end hunger tomorrow. We do that through 4 initiatives that we work on. Let me back up a little bit before. So as a food bank for this region, we cover 26 counties, so 10 in Missouri and 16 counties in Kansas. So we work through a network of agency and program partners to help get food out to people who need it directly. So we're working on 4 different initiatives: feeding children, feeding seniors, feeding families, and healthy eating. So through that network of partners, those are our partners who are out doing the work in their local communities, such as food pantries or produce distributions, community kitchens. We have several programs aimed specifically to seniors for access to senior health and produce for seniors in need, as well as for our Feeding Children initiative. So Back Snack and Kids Cafe are 2 great ways that we help to get healthy nutrition out to kids who need it. We also work on several programs related to SNAP outreach, which is the food stamp program, helping people to connect to those types of resources and benefits. And we have a team of nutrition services folks who are helping with nutrition education, a lot of coaching and capacity building for our agency network as well. So as a food bank, we are a member of Feeding America, which is the national network of food banks. Across the country, there are 200 food banks, and we're the Feeding America food bank for this region. Again, working with that network of partners. Prior to the coronavirus, we know in our area 1 in 8 people were food insecure. Again, maybe they didn't know where their next meal would come from or have access to that nutritious food that they need for their families. And that includes 1 in 7 children in our area. Last fiscal year, we distributed 65 million pounds of food throughout our area, which was a record-breaking year. To compare that, the previous fiscal year, we distributed 54 million pounds of food. And so you can see there's a big spike, which we'll talk about in a minute. There's a big spike due to the pandemic. And the need continues to be high in our area.
All right, thank you. So Bob, you're a doctor. So from a medical perspective, what do we know about the impact that hunger has on health?
Thanks, Matt. I think it's helpful to think of this actually in the same sort of phases of life that you were talking about with your initiatives by different ages. As a pediatrician, I'll start off talking about young children. But, you know, early childhood sets the path for somebody's health over the course of their whole life. It establishes habits related to all sorts of things, including healthy eating. When children are young, the first few years of life, very critical things are going on inside their body. Their brains are being wired, pathways are being laid down, organs are being developed, and we know that certain types of fat, certain types of proteins, and other nutrients are critical to development at those stages. And those are windows of opportunity that you can't go back and address later in life. That nutrition is critical when those things are going on within that child's body. Thinking about another group of people, pregnant women. We know how important nutrition and good healthy food is both to the pregnant mothers as well as their babies. We know we've learned a lot over the last few decades about the environment that babies experience inside the womb and how important the social context is, the stress that's being experienced by pregnant women, maybe from food insecurity or other sorts of things in their life, and how important the nutrient environment of the mother is, again, in helping that baby be born healthy. So breastfeeding becomes an extremely important period of time for women to make sure that they're getting their nutritional needs met for themselves, but also for the nursing child. As people get older, many of us accumulate chronic diseases in our lives, and we know that nutrition and diet is incredibly important to a number of chronic diseases, probably most importantly diabetes, but it also affects a number of other very common conditions like high cholesterol, high blood pressure, congestive heart failure, and obesity, which in and of itself is a risk factor for other chronic diseases, certain kinds of cancer, those things. Then moving to elderly persons, their health is much more fragile than at other points in their life. They may be socially isolated, they may be finding it more difficult to prepare or access healthy food, and if they are ill or have an injury or recovering from something, that nutrition becomes incredibly important to them regaining that strength and health and having as productive and meaningful a life as they can in their last several years. So no matter how you think of it, the relationship between food, nutrition, and health is critical from birth to old age. And I hadn't thought ahead of time of the linkage with the programs that you guys are targeting to different age groups.
Okay, thanks, Bob. So let's talk more about how these two areas intersect and why it's important for food banks and other hunger relief organizations to work with healthcare providers and vice versa. Bob, why don't we start with you?
Great. I have a graphic that will hopefully help explain some of this. If you see the various circles on here, we think of what is it that makes us healthy, either as an individual or as a community or as a whole state. And it turns out that healthcare there on the right is obviously important to how healthy we are. What healthcare do we have access to? Is it affordable? Is it high quality? Is it provided in a culturally competent manner for the different groups of people that are seeking health care? So I don't want to minimize the importance of health care. It certainly is important. But it turns out we've learned that these other areas actually influence health more than healthcare when you take them all together. Let's start at the top, economic stability. That includes things like having a job, the income that a family is able to gain access to, assets that they may have in savings that will help them get through a turbulent time with some financial stresses. And overall, the economic resources available to people influence a lot of the other parts of this diagram as well. Let's talk about neighborhoods next. How safe is somebody's neighborhood? Is it safe for them to go out and get exercise and walk around the neighborhood? Are there places for the kids to play? What's the housing like in that neighborhood? What's their own individual housing situation? Do they feel secure in their ability to stay in that housing situation? Is it environmentally safe? Lead and other sorts of things that can cause health issues. What's the broader environmental situation in the community? We know that lower economic communities tend to have higher environmental risks present as well that can cause health issues. What's available in the community in terms of things like a grocery store? How easy or how difficult is it for somebody to get to a grocery store? And if I can stop drive my car to the grocery store a couple times a week and pick up the food that I need, I may shop differently than if I have to rely on a friend or a relative to take me once a month to the grocery store, and I'm not going to buy a bunch of perishable fresh fruit and vegetables if I'm not going to be able to keep them fresh for a whole month. So you tend to make choices about the kind of food you buy that can affect your health. And I touched on this, transportation, not just to get to the grocery store, but it turns out transportation is an incredibly important factor in how healthy we are because of what it gives us in terms of access to other resources in the community that we need. Let's go next to education. We know that education is related to economic opportunity, ability to get a better paying job, but it's related to a lot of other things that can affect health, like how well do you understand what's going on with your own health, your health literacy, so to speak. Are you able to be an effective advocate and an assertive person? Is your family able to help be an advocate for you and your health care? It affects your coping skills and how well you may be able to adapt to different stresses that you're experiencing in your life. So education has, again, a very important effect that impacts a lot of these other areas as well. The last one I'll touch on is this broader social and community context. The laws that exist in a community or in a state, the policies and how they're operationalized, things like taxes, what is the tax structure like? What does that create in terms of the opportunity for safety net programs like food banks and other sorts of things that may exist at the community level? Food taxes are something that we've talked about a lot in Kansas the last few years in the legislature. You know, what's the tax structure and how does that enable people to buy healthier food and save money to be able to use on other essential things in their life? And I would be remiss if I don't mention the concept of racism and discrimination that exists in many communities for many people in our communities related to race as well as other factors that can lead to discrimination. Those sorts of factors affect our health in profound ways, from how we receive medical care to the opportunities in all these other areas around employment and education that we may have available to us. And Matt, I'll add one thing that sort of ties this whole thing together is the concept of toxic stress. As you think about a lot of these things, whether it's housing instability, not knowing where your food's coming from, losing a job, discrimination, there's a concept in health that has become really prominent the last few years of toxic stress. We know that toxic stress can affect your mental health and your behavior. It also affects your physiology, your biology. It can change the way your body functions, hormones flow, different sorts of things happen. So addressing these things holistically in the concept of thinking about the toxic stress that exists in some people's lives is really important.
Thanks, Bob. Jessica, what are your thoughts?
Thank you. I will echo a lot of what Dr. St. Peter lined out from Harvester's perspective as well, which really highlights of why we need to address this as hunger as a health issue, and that there's an entry point for food banks and healthcare to work on these types of issues together. Clearly it's the type of work we need to be doing for the good of the people that we stand with and the good of the health of our communities. So I'll go back to our mission statement. So we work to feed hungry people today and end hunger, and work to end hunger tomorrow. So we see this work at Harvesters where this intersection of hunger and health, we see this more aiming towards the second half of our mission and this ending hunger work. So we know there's always going to be a role for us within the safety net or the emergency food assistance, but then how do we look at this as a longer term, let's feed the line, but also let's shorten the line, or ideally let's end the line altogether, and aiming towards this longer term health and wellness and stability. Some of the things that Dr. St. Peter outlined as far as health and outcomes and the role that food has in that, and we know, again, distributing 65 million pounds of food last year, we have a responsibility in the type of food that we're distributing and for the longer term health outcomes for folks in need around our area. So a couple different things that I would mention here too, again, back to these social aspects or the structural aspects that are putting people into positions where they're having to make these trade-offs and hard decisions. We know that none of these needs exist in isolation, right? It's not like, well, today I'll figure out housing and tomorrow I guess I'll worry about food or prescriptions, right? It's all all together, and people are making trade-offs and brave choices every day. And there's any one of these things, if it's out of balance, it's going to have an impact on your health and well-being. So again, if we can work on the nutrition as an entry point, as how do we help you move forward on goals because your food crisis is solved, then that's where we want to be for sure. We know too within our area of people who are visiting food pantries, 37% have self-reported that at least one person in their household is diabetic, and 62% have reported someone in the household with hypertension. So again, like looking at that of people are coming to Harvesters and our network trusting us for, we're going to help as best we can, trusting again, even if they wouldn't articulate this is a health decision, we can't exacerbate these chronic illnesses either. So we know that we have the type of food that we distribute is critical in those types of things. And to tie it back together, I would say again back to the social determinants that Dr. St. Peter outlined of there's really no way we can address food insecurity without talking about these broader issues, the root causes that are driving these types of things. So food insecurity, it might not be about food at all. Actually, it might be about your transportation or prescriptions or healthcare or housing stability or low wages, right? So there's a lot of different things that are driving this, in turn that are driving the health disparities that we see as well. That is kind of setting the stage for the bigger picture interventions that we can see.
Okay, so let's get more specific. How is this work specifically playing out in our region, and what programs or other interventions are in place right now? Jessica, I'll start with you.
Thank you. Yeah, it's really exciting work, and it's new work for Harvesters. So I would say within the last few years, we've seen a lot of really great momentum within our healthcare partners. And these are new stakeholders for Harvesters, and same way it's new stakeholders for the healthcare world to engage the food bank. It's a lot of these types of conversations about like, why would we be working on this together and making those connections? But people get it, and it's very intuitive. Of course, we should be working together on these types of things. There's several different levels of interventions, I would say, that we've developed with healthcare partners. And I would say it looks different for each community and each different, again, there's a lot of stakeholders, so it might be a primary care, or it might be care coordination within a hospital or emergency room or an endocrine clinic. There's payers and providers, right? There's a lot of different ways of how we can work on hunger as a health issue within a healthcare setting. So there's a couple different examples that I would share, again, kind of stair steps into different levels of how intense these interventions might be. So a lot of the first places that we've started have been helping to even just train and have some conversations with healthcare partners around, yes, hunger is a health issue and some of the different things that they're working on. Within the Affordable Care Act, there's a lot more language too that healthcare partners are working on, that they're also addressing these social aspects. We found that food is a really good, easy entry point, because it's solvable, and there's a good solution in place that we can address food, where some of these other things are a little bit harder to tackle, but we can at least start with food. There's a lot of healthcare organizations in our area and across the country really that are screening for food insecurity. So we think about in your when you go to your primary care or when you check in with your physician, that they're asking questions. You know, I think of when I visit my doctor and all the questions that you're asked, but now people are asking about, do you have enough food for your family for this in the last 12 months, right? And now people are screening for transportation or prescriptions, things like that, right? Looking at these social aspects. So we developed these little tear pads. It's just a resource tear pad. It looks like a prescription pad because, again, just a good little resource within a healthcare partner of, if I'm saying, yes, I need help with food, or I don't have enough for my kids, that's a new type of conversation to have with your physician. And at the very least, you can leave with a resource that shows how you can access our agency network. So there's most likely a food pantry near you or a produce distribution. Our SNAP helpline is also on here, so you might be eligible for SNAP, and we can get connected to those types of benefits. So that's a really good, easy starting point of, at least people can leave with a resource if the healthcare location in that practice isn't quite ready for a programmatic approach. We do have some other programs that are going much deeper. We do a program called Kids Cafe, which is an after school or summer meals program that works pretty well in some clinical settings. So again, thinking if you're at your pediatrician for yourself or your sibling, that means you're not in school or you're not at your after school programs, you might be missing a meal. So we can do a quick lunch or a meal at those areas. SNAP outreach is another good way to interact with the healthcare world of, again, just people might be eligible for food stamps, refer to our helpline that we can help get those benefits rolling, that then can help people shop for themselves with making those healthy choices. Some of the more in-depth programmatic interventions that we have are like a pop-up produce distribution. So think of primary care. We do some of these with some health departments around the region, or the VA has one of the locations in Kansas City where we have it's a pop-up produce distribution. So in their lobby, we're set up on a couple tables. Feels like a farmer's market that people can walk through. We've switched models a little bit during COVID for safety measures, but thinking through again, as you're in your primary care or the VA, you're there for maybe a nutrition class or some sort of financial coaching, or you're going to pick up a prescription. You can also grab some fresh produce at that same time. And physicians are telling us all of these models. It's a really great, it's a great kind of open door for conversations that otherwise might not have happened when you're not in the exam room, you're not getting bad news. You're there to pick up groceries. It's a really good way to also re-emphasize some of the nutrition messages that might be out there, nutrition coaching around, hey, let's try low sodium. Have you tried this? Here's a sample. Did you know, here's zucchini and squash. Did you know you could roast it? Those types of things. It's an easy way to reinforce some of those nutrition messages. There's a couple other programs that we do that go much more in depth, that are more along the lines we call a prescriptive pantry. There's one that's a pre-packed box of food that can go out. We're doing this in Topeka and around some of our Kansas counties. It's a pre-packed box of food that it was designed with a dietitian, so it's perfect for a diabetic or a hypertensive diet. So it's shelf stable, it's low sodium, no sugar added, lean protein. I tell everybody it's not anything magic. This is good food that we all should be eating, but it is there. You're getting it at your healthcare location, so it's not this whole extra trip to the grocery store or thinking, ooh, what did they say? Or I don't know if my kids will like this. It's all built in right there. So some of that is happening here in Topeka, Stormont Vale, in a couple programs. And finally, I would mention our prescriptive pantry with Samuel Rogers, which is one of the health safety net clinics in Kansas City. Within their diabetes management program, we have a pantry that people can shop through. Again, every choice is a healthy choice, but it's meant to be specific to diabetes management. With really the whole idea around how do we get the right food to the right people at the right time, which is critical, again, to all these different aspects that we're talking about. And it's opening up doors for physicians and the healthcare field to talk about this in a different way and bring in a lot of different stakeholders. And it's sort of this idea, it's shifted the conversation from you're in need, poor thing, let's go to the food pantry. That's not the message. It's about, this is the type of care that we have for you. This is the way we care for you at Stormont Vale or at Children's Mercy or St. Luke's. This is a part of your overall health plan, and food and nutrition has to be a part of it.
And Matt, I just want to add, it really is a sea change in how many healthcare providers are viewing this. How can we do this screening for the social determinants of health, because we know that can actually drive up healthcare costs, and we've got to be worried about helping to control healthcare costs. That's a sea change in the healthcare world to be thinking about that. Why would a hospital participate with community groups to try to line up transportation and food and the sorts of things that we know once someone gets out of the hospital back in their home community is incredibly important in keeping them out of the hospital. And so hospitals, insurance companies, everybody's beginning to realize the interconnectedness of these sorts of issues.
And actually, I would add that we know there's a good study out right now that we know that people who are food insecure actually have higher healthcare costs, yes, driven by their food insecurity. So if we can address the food and nutrition, that's going to have a great impact down the road.
Very interesting. So, so far we've talked about hunger and what we've been doing about it before COVID-19, before the pandemic. But I know the pandemic has had a huge effect on everything in our lives. So what are we seeing now? What's happened over the past 5 months? Has it affected some populations more than others? And then what do you see unfolding over the next, say, 6 months or so? I guess we'll start with you, Bob.
All right, I'm going to throw out a couple numbers not specifically related to food and nutrition yet, and then Jessica will jump in there. But the impact has been just enormous. There was just a study put out by the Aspen Institute recently that estimates that more than 350,000 Kansans are at risk of eviction just due to COVID-19. So you think of that diagram and how health and all of these things are interconnected. 350,000 families in Kansas that are at risk of eviction. 87,000 unemployment claims filed in the state as of August 1st. The Census Bureau is doing a really interesting thing now called a pulse survey. They're just doing it frequently just to get the pulse of things going on. They showed that 45% of households, almost half of households, had a loss of job income. So they may still have a job, but maybe their hours have been cut back. Maybe they've been shifted to a different position. But almost half of households experiencing some sort of loss of job income. And this data is all the middle week of July, so very recent. 39% of households reported delaying medical care. That's something we should worry about from a health perspective and a potential long-term healthcare cost perspective. Another 25% had housing insecurity. 29% of households with children are behind in their rent. Almost 1 out of 3 households with kids behind in their rent right now. The TANF, which is a cash assistance program, the caseloads have increased 47% just in Shawnee County compared to a year ago, 26% in Johnson County. We think of Johnson County, maybe not being affected by some of these trends. A 26% increase. SNAP or food stamp participation up as well. You're probably going to talk about that. And I want to make one other point on sort of the economic aspect of it. For people that make more than $32 an hour, the unemployment gain or the employment gains have pretty much put that group of people back where they were prior to the pandemic. But for people making less than $14 an hour, their employment rate is still 20% below where it was. So this is disproportionately affecting people at the lower end of the income scale. And thinking about the impact of all this instability and economic stress on the ability of children to learn effectively at home, the digital divide that exists in terms of having internet access or adequate devices to be able to learn at home, the stress that's being generated in homes because everybody's at home. Maybe there's not as much food on the table as there used to be, not as much income available. And it's having an effect on employability. The people that don't have jobs right now or are looking to move up in the workforce are being affected by their ability to interview, to be prepared, to really be able to be successful in seeking those new opportunities. And then I'll just throw out another area that we don't really have a lot of evidence about, but I think it's one that we'll learn more about over time. How is all of this stress and the food security issues related to that, how well does that affect our ability to fight infections, whether that's COVID or we're getting ready to come up on flu season, all the other respiratory viruses that are out there. These sorts of things we know are not good for human bodies in staying healthy and resisting these sorts of problems. So,
Jessica, what are you seeing?
So across the country, again, we're a member of Feeding America, which is a national network of food banks. So I'll start high level. So prior to COVID-19, around 37 million people across the country were food insecure, including 11 million children. Now that projection is closer to 54 million people across our country, including 18 million children may be experiencing food insecurity because of COVID-19. So huge increases that we're seeing across the country. And here locally, that is definitely the case. Again, I mentioned earlier, 1 in 8 people prior to the pandemic, 1 in 8 people were food insecure. That number now is 1 in 6 people. And now that's 1 in 4 children who are food insecure, 25% of our kids who might not know where their next meal is coming from. Again, with all the uncertainty that's happening, school or not, right, there's a lot out there that we just don't know. So within our region, again, 1 in 6 people who may now be food insecure, that's an additional 100,000, over 100,000 people in our region that we're ready to respond and help with, but again, that's significant, and that's going to take a lot of partners and a lot of resources to help meet that growing need. I mentioned that last fiscal year we distributed 65 million pounds of food. About a third of that came within our COVID response. So from March to the end of our fiscal year, we distributed about 22 million pounds of food throughout our service area, which is, again, every week was a record-breaking week to get food out through our partners. We did a few that we harvesters ourselves hosted. Some we called these mega mobile distribution, so it's a drive-through distribution. Most of our pantries and our partners across our region, again, those 760 60 agency partners. How do you do food insecurity work and addressing hunger in a way that's safe? When you're hearing, remember the early days of the pandemic when it was like, don't congregate, don't come out in groups. But again, what's the trade-off, right? Of do I risk exposure to something? But I need food on my table for my kids or my grandparents or whatever that is. So we worked with our agency network for a lot of newer, shifting some of the distribution models to work on some of the safety aspects. So most of our partners are doing a drive-through distribution at this point, which there's some trade-offs where it's not maybe the level of choice that we might want, but it is safer, low contact. Even things as simple as, we can do a verbal verification instead of signing in, so you're not sharing a pen and passing a clipboard and things like that. So some of those types of things that have shifted the way that we're getting food out. And the drive-through distributions have been pretty quick and effective to get a lot of food out, and primarily fresh produce out to people who need it. Again, kind of this idea of the right type of food at the right time for families. I would also mention that, again, our network, most of our agency network, most of them are volunteers. And they were able to stay open. They definitely stood tall during this response and still are ready to respond and active in that. So if you had to close because of health or safety or volunteers that were impacted, but most of them were open and remain open. We also have been working through some of our USDA commodity programs and the government programs that have had some waivers and exceptions in place, which have actually been helpful to expand the reach of these programs by letting up on some of these things. Even like the congregate meals that we used to do for kids under our Kids Cafe program, we can still do that, but it's a grab and go model. So it's not, you got to sit and eat the food right there on site. You can just grab it and take it home with you, again, with these health and safety measures. There has been a lot of changes with the SNAP program. Again, a lot of these types of waivers and exceptions that have helped to expand the program, which is what that program is meant to do. It can respond when it's needed. I would say too, there has been an impact at Harvesters and across our network, and an impact on our volunteers and food drives. So again, thinking about what can happen and what's coming through the supply chain. Food drives have been lower. Volunteers, we just can't gather. We can't have as many volunteers around. So there's been an impact there. People are still generous and ready to support, but there has been an impact to some of our overall work. But in the meantime, still able to get a lot of food out to people who need it. To wrap up, I would say, sort of back to what Dr. St. Peter had mentioned, we expect that this we feel like we're kind of on this cliff, right? There was a lot of the relief that was out there has expired. People are maybe getting back to work, maybe not, maybe underemployed, not getting the hours or the wages that they may want or need. And so we know there's this cliff around housing, childcare, and jobs, which as we've mentioned, it leads to food insecurity, or could be a factor in someone's food insecurity. So we know that we expect the need to continue to be high. And all of this, again, also just kind of reiterates the entire point of why we would talk about hunger as a health issue. The pandemic has definitely highlighted health disparities that we've known have been there for quite some time, but it really has brought to the forefront any of these kind of community disparities, and again, needing to address this at a larger kind of root cause level to really get to the heart of this.
Okay, thank you. And thanks to our panelists. I wish we could keep talking, but we were out of time. It's been a fascinating conversation. I've certainly learned a lot. Bob St. Peter and Jessica Kejr, thank you so much for your time today. So as you can see, there is still a need for more resources for the people in our community, both to address their short-term hunger needs, but also to address the health of their families and their community for the years to come. And we'd like to thank our corporate sponsors. They're always so generous to help us do this work, to help Harvesters do this work throughout the community. But you too can make a difference. So what can you do? Well, the fact is any amount helps. Every dollar that's donated to Harvesters provides 3 meals, and that is 3 meals, that's a whole day's worth of nutrition for one person for a whole day. And so you can see that your dollars go a long way to making our community healthier. Our specific ask, if you can, is to give $19. So if you haven't given, please consider giving $19 now. If you've already given, please consider giving $19 more. That would do a huge amount for the people and the families in our community. The way you do that is to visit harvesters.org/forgood to make your donation today. So again, I hope you'll join me in thanking our panelists. They've been wonderful. And I also hope you'll join me with Harvesters President Valerie Nicholson Watson on Thursday, October 7th for our second For Good virtual event. The details are also available online at harvesters.org/forgood. So thanks again for joining us. This is just the first step to making people's lives better in our community. Thanks very much.